everyone to the Global Café today. My name is Katrina Bazanis, Director of Policy and Advocacy at the IFA. And today the cafe is focusing on an issue that receives often too little attention despite the grave consequences for older adults. And this issue is the maltreatment and abuse of older adults. So the World Health Organization has estimated that 1 in 6 people aged 60 years and older experience some form of abuse in the community annually. And despite the prevalence and adverse consequences for older people and their families, this issue receives little prioritization in society in general, but also particularly in policy. One of the challenges to addressing the mistreatment of older adults is the lack of standard definitions for these acts, which impacts how abuse is measured, tracked, and combated. To talk with us today about some of these challenges is Dr. Marie Beaulieu. Dr. Beaulieu has recently retired as a full professor at the School of Social Work of the University of Sherbrooke and is a researcher at the Research Center on Aging. In October 2022, she was recognized as one of the 50 world leaders of the decade of healthy aging by the United Nations. And between November 2010 and November 2022, she has held the position of research chair on mistreatment of older adults financed by the Quebec government. Since July 2017, she co-directed a World Health Organization collaborative center at the Research Center on Aging, specialized on age-friendly communities and countering mistreatment. And the principal focus of her 30-plus year career has been countering mistreatment of older adults and promoting a wellness care approach as well as ethics. So Dr. Beaulieu, thank you so much for being with us today. And so to kick off our discussion, I want to ask a little bit about your background and how you became interested in this field of work. So as we mentioned, you have a very long and established career, 30 plus years. That's amazing. And there's kind of so much we can talk about in terms of your own work and research and advocacy, but I want to take it back to the beginning a little bit and ask, how did you become interested in researching the mistreatment of older adults and what sort of resonated with you about this issue?
Well, thank you so much, Katrina, and good day to everyone. Good morning, good afternoon, good evening. That's the joys of being in a meeting like that where people are at their home, but we're all together at the same time. I'm a criminologist by background. So I did my first degree and my master's degree in criminology at University of Montreal. I started in the early 80s, so that was a few years ago. And at that time, we were really just beginning of talking about victims of crimes. So the interest in criminology had been put on the aggressors. It had been put on looking at the correctional services, planning the response to crime. But it was really a shock for me to realize that victimology was not developed at all. So I completed my master's and I started working as a research professional at the International Research Center on Comparative Criminology. So comparative was from all around the world. And we did a study on fear of crime in the major cities of Canada. And I was very surprised to see that the answers from older adults were quite different from the ones of the other age groups. And especially they were more trustful in the system, and they were more afraid of being victim of crime. However, the prevalence rate of victimization was a lot lower for them. So it's kind of a paradox, more fearful, but less victimization. So that really caught my attention. And we realized by that study that actually probably all the area of more domestic violence towards older adult, family violence towards older adult was not captured by that study. So that was the first kickoff. The second one was a study I did with the government of Quebec in '87. And there was a first government committee looking at elder abuse and neglect. And they realized that they didn't have the voices of older adults. So I've been doing a series of interviews in congregate housing for seniors, really trying to see what they thought about quality of life, quality of services, and also victimization. And this was so interesting to me that I decided to do my PhD on abuse of older person in nursing homes. And I did look at it from a management point of view. What do we do when we're facing a case of elder abuse? And that was the kickoff. I started there. So I finished my PhD in 92, and I never stopped working in the same field since then.
Thank you for that overview. And I think you've touched on quite a few things that I think we want to pick up in our conversation as the discussion rolls on, including, the importance of the voices of older people in this work, but also just, the lack of understanding around abuse and the treatment of older people. But I think before we kind of get into the meat of the session and why you're here to speak today, which is talking about definitions of abuse, I'm wondering if you can kind of set the scene for the audience and just speak a little bit about what is the prevalence of this issue, what is the burden of this issue, and then that can kind of set us up for a nice conversation on some of the more detailed nuances.
Yeah, well, you started by quoting some data from the WHO, and this data is important because it was done in a comparative way, trying to look at all of the prevalence studies that have been done in the world and trying to address what is the prevalence of elder abuse. So you said for people living at home, the prevalence that it was estimated by that study is 1 person out of 6 is going through abuse each year. I'm saying each year, and that's really important because the data was looking at the past 12 months. So that means that an older person can go through abuse this year, not next year, not the other year, but then come back again. So 1 out of 6, but. The problem is that the quality of prevalence study is very variable. So we're not always having the good data to compare, and we have to know what are we looking at. So there are some common grounds like physical abuse that will be looked at, but certain studies will not look at, let's say, sexual violence, so that will be not captured. So others will not look at all the types of neglect that we can see. So that is really we know it's the tip of the iceberg, but 1 out of 6 means around 16-17% of older adults living at home. And if you ask me the question regarding the prevalence in institutions or nursing homes, or depending on the way you call it, then it's even more difficult because we don't have a lot of studies done by collecting data with the older person themselves, because a lot of time the people in those homes are not capable of answering the surveys. So we go with indirect data, and it's mainly testimony by practitioners and testimony by family members who've seen things. And then we have very high prevalence rate. And actually, one of the study that has been shaking quite a few people was from colleagues from Germany, where they interviewed practitioners in those institutions. And the majority of them said that themselves have been neglectful or abusive in the past 12 months. And it was due to all different structural contexts. So we have a tip of the iceberg. We still need to continue, but prevalence studies are quite expensive, and it's not always done, like I said, the same way, which will complicate a lot the possibility of having a general portrait.
Thank you for that answer. And I think that's a number of important points that you've raised in terms of, some things that we can hopefully work towards getting a little bit better at in terms of having a real true estimate of what this problem is and how big the scope of this problem is. So that kind of brings me to my next question, which is, you've been involved in leading the development of priorities for tackling the abuse of older people. And we're in the midst of the UN Decade of Healthy Aging. We talk about it all the time here at the IFA. I'm sure everyone on the Global Café has heard us talk about it a number of times. But this is really an important kind of decade for rallying around kind of a number of issues to improve the lives of older people, and you've been kind of heavily involved in that. So I want to ask about kind of your work in identifying some of the priorities for tackling abuse, and what did you find were some of the greatest challenges, but also the things that we need to prioritize?
Yeah, well, let's start with the decade of healthy aging. Like you said, we
Sure.
talk a lot about it, but I think it's really important. I was involved with WHO during the past few years, and we've been doing a series of different projects, but one of them was actually really trying to identify which would be the 5 priorities for us to tackle during that decade regarding elder abuse and neglect. So we did a series of different consultations and surveys, and also a very strong discussion with a series of stakeholders from all around the world. And the way we've decided to work was to provide 15 teams and ask our stakeholders to rank the teams to see what would be the 5 priorities. So one of the 15 teams was definition. So do we know what we're talking about? And actually, we were quite a few thinking that the definition was still an issue because we don't use the same term, we don't use the same definition. We can hear sometimes elder abuse, sometimes senior abuse, sometimes maltreatment, sometimes mistreatment, sometimes violence, sometimes neglect, and so on. Is it all really the same? So in that series of 15 teams that the stakeholders had to rank, my surprise, and I was not the only one in the team, was to see that the question of definition came the lowest. It was 15th in the 15 rank. And I say, oh, that's interesting. So people all agree that we're not talking exactly about the same thing, but people don't want to probably, and I put it on quote, lose time on definition. They want to be closer to the action, which I can understand. But from my point of view, it really complicates the thing because we're not talking about the same thing, not only all around the world, but even in my own country, Canada. I was actually doing some work last year with the Department of Justice, and I realized that there was more than 15 definitions all around the country that were actually circulating. And we're not talking about the same thing from one province to the other. Like some provinces will recognize self-neglect as a type of mistreatment, others will not. So coming back to the UN, just to finish my answer on the UN, what came out as the 5 priorities in the field of elder abuse and neglect is the first one, to combat ageism, which also that was a surprise to us when it came first. So it's kind of saying that if you don't work on the general context about the place of older adults in societies, you will have a lot of difficulties getting to the other step, to counter mistreatment. The second one was to generate more and better data. But let's be realistic. If we want more and better data, that means that we need good definitions to see what we will calculate and what we will not calculate. The third one was to develop and scale up cost-effective solutions. So really working on practice and finding what works, what doesn't work, what are the impacts of intervention. And in that perspective, in the past few months, the WHO has developed with a series of partners all around the world what they call an intervention accelerator. So really funding research, trying to see what works, what doesn't work in intervention. The fourth one was making an investment for addressing the issue. And finally, it was raising funds to tackle the issue. And we know that the raising fund is a real issue in certain countries where actually there's not much money put in looking at elder abuse and doing some actions to counter elder abuse. And in some countries, it's mainly NGOs that are really doing the work.
Yeah, so I think that's kind of a great overview of a number of strategies that we can work on, but I want to kind of take you back to the definitions and honing in a little bit more on the definitions and why is this so important, and how does that impact our ability to then carry out some of the other strategies that you mentioned there. You kind of touched on it a little bit with generating data, but also in terms of, a lot of people may say, as you mentioned, they want to be closer to the action. They want to be maybe more focused on the intervention and things like that. So I want to know, how does definitions also impact the ability to execute good interventions or develop good interventions as well?
Yeah. Maybe I could start by sharing one of the most common definition that is used, and it's the one by WHO, so the World Health Organization. So I took the one which is online now, which is already an evolution from the initial definition that we agreed on with WHO in 2002. So elder abuse is a single or repeated act or a lack of appropriate action occurring within any relationship where there's an expectation of trust, which causes harm or distress to an older person. So I'll come back to each of these points, but I have to continue with the second paragraph. This type of violence constitutes a violation of human rights and includes physical, sexual, psychological, and emotional abuse, financial and material abuse, abandonment, which was not always there in definitions, neglect, and also a serious loss of dignity and respect. So if I look at it again, one of the things that is really contested, I was saying elder abuse is a single or repeated act. I've seen quite a few times people debating on, does it has to be repeated to be elder abuse, or is something occurring only one time can be defined as abuse? And that is already a first part of debate. Then a lack of appropriate action. What people do understand of that? Is it neglect, or is it also an action that has been done, but that the action is actually more dangerous for the older person than if there was no action? Another component of the definition that is really debated is what is an expectation of trust. And I'm amazed to see that many times we've been defining elder abuse more as an interpersonal problem. And we forgot to look at collectivities that can be abusive towards older adults, and also organizations that can be abusive towards older adults. So one part of the work I've been doing in the past few years is really to try to enlarge who can be included in that trust relationship. And in certain cases, we even have to work with the people saying trust doesn't mean that we're looking only at people who have been in relationship for a long time, because sometimes people will tend to really shrink it only to the family context. So it's a lot broader than that. We have to think about neighbors. We have to think about service providers. So it's important that we really look at all these issues. Then we're talking in the definition about a series of consequences. And we still have a lot of work to do to really document short-time consequences of abuse and also long-term consequences. And we see that there's kind of four types or four families of consequences. And it's not really related to the type of abuse you went through. I'll give you a very clear example. I can be financially exploited, but I will have some psychological consequences. I will certainly have some financial and material consequences, but I could have physical consequences of that, because if I completely lost sleep, if I stop eating and everything, I can fall sick. And finally, the fourth big family of consequences that we have to look at is social consequences of abuse. Like if after abuse, I'm self-isolating, then there could be a lot of danger for my health and exactly even more for my quality of life. And we know more and more the effects of isolation of older person. And it is said that people who are isolated will have more disease and probably die before the others. So it's really important. So these are all things that we have to look at in the definition.
I think something that you just said that really hits me is that idea of trust, which is, I think, a really, really important point. And before we move forward, I do want to go to the chat because there's a couple of things in the chat that you've picked up on. So I want to see if we can get some questions. So we have a question from Shmuel, who participates every week in the Global Café and is a great contributor. And he has a question related to something that you've just mentioned, which is what is our understanding about the mental health impacts of mistreatment on older people, or I'm not sure if he's referring to mental health, but also kind of cognitive impact, but you kind of started to touch on that. So I wonder if there's anything more you can say about that.
Yeah. In one of my research projects that was completed last year, we started to look at different consequences about what we know and we don't know about the effects of abuse. And I was really surprised to see that we don't have a lot of material looking at short-term consequences and long-term consequences. So we talk about consequences, but do we really know how much the person is affected, like during the time it happens and in the next few days or weeks, but also what is staying on all lifelong? And I think it's really important because one of the things we discovered in research during the past few years, and when we started to introduce a lifelong perspective, we saw that older persons who go through abuse, one of the risk factors that is now documented is having gone through abuse or violence at other stage of the life, and especially as a children, okay? And I'm very careful here. I don't want to say victim one day, victim all your life. But I think what I really want to say is when you went through victimization, it can have some impacts on your full life. And if we don't do the correct intervention at the good moment, then you will really keep the sequels of that. And part of the sequels are on self-esteem, capacity to react to certain numbers of stress, integrating the fact that it's normal to be abused or you deserve it. So that's very terrible. So all that to say that we have a few indicators about mental health issues that can be impacts of abuse. But more research is needed in the field. But that's a very good question because we know it's there.
Definitely. So I also want to go to one of the contributors, Lucy, who has put a little bit about Czech Republic and sharing some definitions as well as some prevalence. Lucy, I wonder if you're on the line, if you would like to unmute and just share some of your comments with the group, and just I think it would kind of open up a nice discussion for Dr. Beaulieu to also comment on.
Thank you very much. We were very surprised to be actually able to use the quantitative methods to go into population and ask them, because myself, I was very afraid how this will go if interviewer will come to the older person's home. So what we've done, we worked with the interviewers, and we also treated the survey as such, as a way of raising awareness about the issue. So that was something that really, I hope, worked well for us. But what we were not happy to see was this high level of prevalence, and seeing 30% of older people or people 65 and plus being every year encountered some type of elder abuse or mistreatment, or just undermining the human rights and human person as such. And what was quite also striking, that the numbers of course rise when we also ask about, does these things happen in public spaces, like offices or maybe hospitals, because these our respondents were still living in at home, and you address also these differences between what's happening in the institutions and what's actually happening in the homes. But there's another field, and that's the public space. So with the definition we came up with, we were trying to capture that, but what we ended up with is something that has 16 lines of definitions, very complicated. So I would like your input on like how to also see the public space as a space where it is the trust should be happening, because this is what the society is based on. I mean, we have to trust each other, so that goes very much into that. But how to also kind of have the definitions that would work well and help us. This is the goal for Czech Republic now. We are working closely with our Ministry of Social Affairs to actually kind of try to propose a new law against elder abuse that would be kind of broadly touching all these different aspects. But we just don't know if maybe that's just too big to actually tackle. Thank you so much.
Well, thank you for your question. And I would say that regarding the length of a definition, I think a lot of time people will tell us the shorter is better. But if you do it very short, then you're missing a series of nuances. So for the past few years, I've been working with the Quebec government, and then I'm also working now with the Canadian government, thinking on definitions. And what we came to is actually trying to keep a definition short, but having after that a series of paragraphs which will explain in nuance. So, and that's probably the best solution. Because if we have it too long, people get lost into it. But if we have it too short, all the nuances are not there and are not looked at. And you've been raising things about the trust relationship, but also the question of vulnerability is one I think you have here. I see that situational, temporary, or general vulnerability. Sorry, that's a hard one for me. I think that's really interesting because it's one of the things that is really debated all around the world. Do you have to be vulnerable to be considered abuse? I'm not certain of that at all. And when I look at research results, what I found is a lot of times vulnerability is one of the consequences of abuse. So it's not really something that was there before. And I'm always concerned because if we put the question of vulnerability in the definition, we have to keep it very broad as a situation of vulnerability. And that, what I like about your definition in the chat is that you will say that it can be temporary. So it's not always there, or you're saying it's situational. So sometimes you can be placed somewhere where you're more vulnerable. That doesn't mean that you have the tag vulnerable adults. Okay, so that is really something of concern that needs a lot of attention. But I saw in certain countries that services are saying, if you were not vulnerable before, the abuse that you went through is not treated as abuse. It will be treated as a regular crime. So they will refer to crime services. I'm not certain it's a good solution. And one of the other things that I'm not certain that you have in your definition, but that is really debated, is the question of intentionality. Do we consider that abuse is always, we have to prove that it was intentional? Because if it's not intentional, it's not abuse? That's a huge question. And if you want my point of view on this, I consider intentional, but also non-intentional situations. But when you realize it's non-intentional and you're capable of working with both parties, I'm talking the older person, but also the person or the collectivity that abused them. Usually when it's non-intentional and you work as an eye opener, it's much more easy to introduce changes. And then that brings me to the first part of your question that I didn't forget about public space. I totally agree with you. Abuse can happen anywhere where there is an older person. So it's not only a behind the doors situation that happens at home or in institution, but it happens in different type of services in that place. It can happen in public transportation. It can happen anywhere where there's an older person. So this is a broad way of seeing it, but I agree with you.
Thank you. So I think you touched on so many things, which I think is hopefully very helpful in, actually creating a definition that is actually going to be used. And it's great to hear that, in the Czech Republic, there's some initiative from your ministries as well to kind of make an impact on that. So I want to go back to the chat as well. And there's a question from Rebecca Johnson, who's asking if you can expand on social abuse. So how is it defined and what are the solutions?
I was less talking about social abuse. I was more talking about the social consequences of abuse. So maybe I can make the nuance here. So for me, social consequences is all the consequences that will impact directly the social life of an older person. And that will include inclusiveness in the society. And like I say, it can include also looking at isolation. That can be self-isolation, but other time it will be rejection of the older person that actually did ask for help, and the people who are unsatisfied about that, and a lot of time it will be people around the older person that will not support them, then they will reject that person. So we have to document those things. And that brings me to another question that is not directly related to the definition, but it's all the possibility of older adults to ask for help and to be listened to and to be receiving accompaniment to go through services. Because if you ask for help or you call for help and you don't receive it, and if you're rejected, then the situation is even worse. So I was sometimes working with people really involved in prevention campaigns, and I totally agree, we need them quite a lot. But I'm always saying, if we're doing prevention campaigns and raising awareness on elder abuse or mistreatment of older adults, then we also have a social responsibility that if people are more aware, they will ask for help or they will go to services. So we have the responsibility to be there when they want something. And so we have to provide some type of response, some type of accompaniment. If we don't plan that, then we're missing the point, because people are more aware that they're going through abuse, but if they don't know where to go, then they're totally lost. And it's not really helpful to say, okay, now I know that what I went through is abuse, but I don't know where to go to be receiving services related to that. So that's why I always say, if you do a good campaign of raising awareness, you always have to finish it by a referral to a certain type of services. Would it be a name of a service or organization? Would it be a phone number? Would it be something? But you have to be very clear about the next step, because you don't want to create more distress than before.
And just picking up on that thought, is there any sorry, Lucy, I see your hand as well, but I'm just wondering, while we're kind of on that campaigns issue and different prevention tactics and things like that, do you have any examples of things that have worked particularly well, or is there a good understanding of what works well, and are certain resources that are particularly helpful?
Yeah, oh yeah, there's been so many things. Actually, when we're looking at the different types of intervention, and I would say like 3 steps of intervention. The first one will be general prevention. It's really raising awareness, and also a lot of time training future practitioners, and even training practitioners that are already in the field, but that don't always know that much about elder abuse and neglect. So that's the first part. And that, I would say, is really developed all around the world, and we see a series of different things that have been tried, like would it be um, written publicities. I'm seeing sometimes online things, like I'm looking at a website and whoop, something will pop and it's raising awareness about elder abuse. We will see publicity on television. We will see posters. We will see flyers. One of the things that worked really well to do some awareness with older person is actually having meetings with different type of plays, and a lot of time it's older person themselves playing roles, and they will ask people in the public, how would you react in this situation? And people are building the solutions together. So these types of prevention activities are good because people, when they get involved, really get to think how they would react. And I must say that a lot of times we think that we would react always in a very positive way, but we have to admit that sometimes facing abuse, like being abused themselves or being a witness of abuse, people can stay in shock and don't do a lot. So these things will help to create more action. Second type of intervention, very quickly, is detection, like really trying to find the cases. And usually in detection, it's mainly practitioners that are tackled. But if we give to the public a certain number of indicators that they could look at, sometimes they will see things. And the third one is really accompaniment, which is really different at that level.
Lucy, do you also want to pose kind of a follow-up?
Yeah, because what we are, which is very new for us, and I'm learning a lot today. Thank you so much. The thing we are discussing in our team is that what we see in campaigns are just, as you said, for example, a number where to call. But what we feel that people have like zero information, what will happen next. And we wonder if that is not a part of also why they are afraid to, for example, go for solutions. And if you would have some examples, like if some campaigns are actually doing this, once you report this may happen. And this is how we can help you more in detail.
Yeah. Well, thank you for a question. Yeah, I totally agree. I think in the raising awareness, the first thing would be telling people what is abuse, but very simplistically, like really illustrating a series of things. Then giving, like I said, a phone number or a website or a service where to go to. I didn't see many campaigns that are explaining after that what will happen, but when I saw it, what was really interesting, like even saying call the police, well, it was clearly said to older persons, and I'm thinking of a project in Montreal actually, where actually it's not because you call the police that the person that is abusing you will be prosecuted if you don't want to. And I'm thinking especially when it happens in the family, like the typical case here is an older person living with their son, and the son can be sometimes very helpful, but other time can be abusive. And put in that some context of maybe mental health or drug or alcohol abuse. So a lot of time, the older person will report the situation because they can no longer cope with it. But what they want is services for their son. They don't want the son to be prosecuted. So then that really needs to be explained. And one of the other things that I saw here, I don't know, it's the same all around the world, is people saying, I will not ask for help, because if I ask for help, I will be they will pick me out of my home and they will put me in an institution, and that's not where I want to go. Just so to reassure the older person that it's not because you're going through abuse that you will have to be relocated. And actually there's ways of working with the situation where an older adult can stay at home. And probably one of the most reassuring things that I saw were saying to older adults is that you keep all your self-determination and we will work with you according to what you want. So there's only a few cases actually where we will go against the wishes of the older person. That will be when there's mandatory reporting on certain type of abuse or certain circumstances of abuse. And that mandatory reporting included in law is really not that frequent all around the world, but we have it here in Quebec where I live. There's certain things that are mandatory. So there's mandatory reporting, for example, of elder abuse occurring in institution. So that's mandatory. But that, again, doesn't mean that you don't work with the older person. So they have to be reassured that they will be partners in the solutions, and we're not there to impose on them. We really, and it's all the balance about protecting people, but also continue to encourage their empowerment and their self-determination in the cases. So maybe one of the things that could be included more in prevention campaigns is saying that you will still be I wouldn't say the master, but at least you will still be deciding. We will not decide for you. We're teaming with you. And it's all the difference in gerontology between working with older adults instead of working for older adults. So that has to be probably more clear in the campaigns.
Mm-hmm. That's a really great, nice tagline. I think that a really nice takeaway message. So I want to kind of bring it back a little bit to kind of our core topic of discussion, which was definitions. And Dr. Stewin, if you have a question in the chat, I wonder if you want to pose your question as well, focusing on differences between different groups of the population.
Thank you. Oh, thank you, Maria. It's always lovely to see you and hear you. And I always think of very new things and realizing what a multifactorial issue this is. But I just wondered, given the cost of any longitudinal studies that have been done or are being done, and particularly if you see any trends, even just in your own research or that of all that you study, on differences of life course and older men, older women.
Yeah, well, thank you, Cynthia. That's a very good question. Yeah, it's very costly to do longitudinal studies. When we have a chance, and we did it now in Canada, to introduce a module on mistreatment or abuse in longitudinal studies on aging, that's a great, can I say luxury? I don't know, but I know it's not every country that will have that possibility, because the nice thing about longitudinal studies, and maybe to be clear with all the people who are online today, is that you study the same group of person over the time for many years. So you're able with those type of studies to see what is evolving, and you're able to look at a life course perspective, or what are the changes that may or not affect the situation of abuse or mistreatment. So you can be studying the same person like every 5 years for 30 years. So that would be 6 waves of data, and you would see the changes and being able to tackle them, and probably trying to understand when and in which circumstances at one point abuse can happen. So we would all hope that all countries would have that, but I know it's probably an ideal that will not happen for now. So regarding the gender question, and I think you're really raising something really important. Again, last year I did strong literature review, trying to see in the prevalence studies which one were really saying that there was a gender difference and which one were saying that there was no gender difference. And I must say I was surprised to see that when we look at general prevalence, many studies now conclude that there's not that many differences between men and women. And that was a surprise to me. And when we see studies saying there's a difference, like the prevalence study in Quebec showed that there was a difference, and that actually being a woman was statistically significant. So for us in Quebec, it made a difference between the men and the women, but in another studies, it was making no difference. So I still was still need to continue to tackle it, not as general prevalence, but probably per type of abuse. Like what is there a difference for psychological abuse? Is there a difference for physical abuse? And probably we need to continue to tackle it about the differences in the dynamics. Are women more abused by their partner or children? Are men more abused about service providers? I'm just giving examples here. So all that to say that we still need to continue on that gender issue because it's still debated in research. It's not a clear cut for now.
Thank you.
Thank you. I think that also really nicely kind of opens a door. So not only the differences between gender, but also different kind of socio-demographic factors. I wonder if you want to also touch on that, Dr. Beaulieu, as well as how some of these definitions or even prevalence shift based on different cultural contexts as well.
Yes, thank you for opening on that. During the past year or so, and even probably a little more, I've been a guest editor for a French journal, which is called Gérontologie et Société, so Gerontology and Society, that would be in English. And we did a call for papers all around the world, and we received so many papers that it was supposed to be one issue, and actually we're getting to produce the second issue in a few weeks. And in the papers that we received, I was very pleased to see that it was not only the traditional countries who are publishing in this journal, that would be France, Belgium, Switzerland, and Quebec, but also we receive very good contribution from people in Africa. So one paper from Burkina Faso, one from Senegal. We receive a very good paper also from South Korea. And this is really interesting because it gets you to think about what constitutes abuse in a certain culture that is not always recognized in others. And the paper from Burkina Faso is addressing accusation of witchcraft and what is happening to older person who are accused of witchcraft. All the public trials that are out of the justice system, that it's really the community trying to trial these people, how unfair these trials can be, and what are the solutions for people who have been accused of witchcraft, which actually was quite sad to read that if they don't die when they're stoned on the public place, some people will commit suicide. If not, they will get out of their community and go into different shelters. So I thought that was really interesting to try to understand the culture from inside, because the author of that paper is really showing that witchcraft is something recognized by a lot of people in the community. So it's very difficult to tackle the problem that actually for a certain number of people in the community, witchcraft exists. And then it's kind of normal to do that type of treatment who are for the person who are accused of doing witchcraft. And that really got me to think, and I had read about accusation of witchcraft before, but that paper was actually even more in deeply for me, making me think, well, we wouldn't see that type of things here in Quebec, but we will see it elsewhere. And that was just telling me all the nuances we have to introduce in abuse from one country to the other. Another very good paper that we received that got me to think is a paper from South Korea, and it's interviews done with daughters-in-law who by culture are imposed to take care of their mother-in-law. And they're talking about all what they went through in that process. And at one point, they will raise themselves the burden of doing that type of work, and they will even admit how they can become violent or neglectful in those situations. And I was thinking, these are the voices that we don't have often. People thinking about what they did and trying to really situate it in a cultural context where by obligation, by what is there in the culture of taking care of your mother-in-law, how that can introduce situation that can lead to some types of abuse. So all that, and I could give you examples from all around the world, but all that to say that even though if I'm pleading for a general definition of abuse that we can compare our information and everything, I have to really admit also that if we want a good definition that will talk to the people in each community, you have to be able in your definition to introduce all of these cultural nuances that will say that certain things are abused at one place, but they're not really looked at in other places. And it's culturally sensitive.
Yeah, thanks. I think that's a really interesting, I'm sure that's something that could be studied for eons and understanding that, and would take kind of forever to unpack, but that's such an interesting nuance, is how you kind of work through these different cultural contexts, and how does that also allow us to look across data and understand the scope of the issue. So there's one, we're almost coming to the end of our session, but there's one last question, which I hope maybe we can end on before I go to you, Dr. Beaulieu, for some takeaway messages. And that's from Kelly Lewis, who asks, what are some of the key elements that make the abuse of older adults different from the abuse, or from abusive adults, or just of adults in general, and also compared to children? And also, why do current general definitions of abuse not suffice? And maybe I'll add on to that question, which is, what do we need to do? Well, what are some of the kind of key next steps? If our definitions don't suffice, what are the kind of the next steps in creating definitions that do work and do kind of help us serve, whatever we need these definitions to serve?
Yeah. That's a very good definitions. What is really surprising is that looking at abuse or violence or neglect at different stages of life has been developed in sometimes kind of a silo approach, like abuse of children, intimate partner violence, abuse of older persons, violence in school. And there's not always a good connection between all these fields. And I'm saying that to be very polite. Actually, there's a lack of dialogue between these groups. And one of the things that is really important is that when we look at, let's say, children abuse or violence against children, certainly the necessity to protect is there, because per se, especially when the children are very young, they're not capable of self-determination, they're not capable of asking for help and things like that. So as a society, the protection lens has been there quite a lot, and also doing everything that is possible to allow them to continue to develop in the better way as possible. One of the things that is striking me is sometimes people say, oh, if you're training children abuse, you're capable of working in elder abuse. And I'm saying, oop, oop, oop. Let's be careful here. The first thing is not all older adults are considered vulnerable. So, and that is really important, because if we consider all older adults as being vulnerable, this is ageism. And it goes back to our first target in the UN decade of healthy aging regarding elder abuse. The other things that I see is as a difference is I'm surprised to see that we don't work that much in an empowerment perspective with older adults. And and I don't understand why we're not working in that capacity of continuing to develop. And again, it's probably because some people will have an ageist attitude and say, not believing that older person will continue to develop till their end of the life. So maybe these are things that we could learn from and improve in our intervention. Again, the field of conjugal violence or intimate partner violence or family violence and the field of elder abuse doesn't always connect. And that's kind of a pity, because older women can go through abuse that has been there for a long time, especially in their couple. And I don't know why, but we have kind of a hard time to partner together. And a lot of prevalent study of violence against women stop when women are about 50 plus. And one of the reasons that has been given to me is that a lot of time they're done with people who are working on reproductive health. So once a woman is no longer considered reproductive, we gather less data on them, which again is a form of ageism. Like, you don't stop being a woman because you can no longer have children. That's certain. So there's a lot of blind spots that we have to work on and continue to encourage the dialogue. And I hope we could create kind of that spot where actually people working in the different fields of violence can talk openly together, even if we don't use the same terms, even if we don't have the same approaches. There's things that we have to know and share.
Yeah. Yeah, absolutely. So I want to come to you just for a final kind of takeaway messages. But before I do so, I want to introduce next week's speaker for next week's Global Cafe, which I hope you'll all can return back on next Friday and join us for. And so next week's talk will be on age-friendly health, the age-friendly health systems movement and the 4MS. So hopefully you'll join us all next week for that. And then Dr. Beaulieu, I'll just hand the floor over to you for some final thoughts before we end our session.
Well, as you've seen, I will continue to advocate for talking about definitions and really doing good consultations about what do we include or not include in our definitions of mistreatment of older adults. And that means dialogue between different stakeholders. And we need a point of view of older persons. We need the point of view of practitioners. We need the point of view of different actors in that field. And I'm thinking like a consultation that was done by the Canadian government last year. And they produced a report that was called What We've Heard. Well, then at least we have that dialogue about what people think abuse, how it should be named. Like, first of all, what name are we keeping? Do we keep abuse? Do we want to go to maltreatment, mistreatment, blah, blah? And then what should it include? So that's my first thing. The second thing is, even though if I have great ideals about we should be all having the same definition, I know it will never happen. But let's try to find out what are the core important messages that we need into definitions. And let's agree on a less debated definition. And I can understand that we can have that international definition by WHO. But for me, it's really important that government and services and also researcher be part of a dialogue where we can at least have a definition from each in a certain community everyone is capable of relating to. So then we will have something strong that we can evolve in the subject. And for me, a definition is something that is evolutive. So I will give you the example in Quebec, like we have now, we've been having 3 different plan of actions that were provided by the government, one in 2010, one in 2017, and one in 2022. And in each of those plans, the definition is slightly different. And it's because it's evolving and taking into account the evolution, not only in research, but also in practice. And I feel that I was privileged as a researcher to have a dialogue with people working with the government. So people working on social policies and civil servants, and also working with people from the field, and really trying from all these point of view to come with a strong definition and to recognize that in the next plan of action in 5 years, it will evolve again and it will be slightly different because we will better understand what is abuse and what we can do about it. So I encourage everyone in the world, in your own country, in your own states, to do that type of work. It's really important to keep the dialogue flowing.
Mhm. A huge thank you, Dr. Beaulieu. That's an amazing key message to end on. And I think there's, some glowing reviews in the chat. Someone pointed out, I think it's your third time on Global Café. So you're a regular, and it's amazing to also continue to bring new insights to this group, which I think you have certainly done, and certainly are consistently bringing new insights on the topic and adding perspectives to the conversation. So, I mean, I think some of the things that's important to note are just that ability to, we're constantly working towards a definition. Not to say that it will ever happen, but it will continue to evolve. And I think that that's some important work just in tackling, being one of the ways that we tackle this important issue. So thank you so much. A huge thank you for joining us again on an early morning Friday for you. And I also thank you to the IFA team who helps to put on the Global Cafes every week. And thank you again to our audience for being so engaged in the session, and we'll see you next week.